Hi, welcome back everyone. Today's case is person, as you can see from the photo, with multiple missing upper teeth. Okay, this case is different from a slightly actually different from like a person that would may have a single missing tooth. If you're new to the channel, welcome here. My name is Dr. Mo and I'm a dentist. Okay, today I'm gonna discuss why is it important to replace missing teeth in a case like this, what are the solutions, like what's the management for a case like this, and I'll start with how can someone even lose a couple of teeth whilst perhaps maybe the rest of their teeth could be in okay condition, because some of you may be surprised, wait, what, like they actually have somewhat of decent teeth with regard to the rest of the teeth. Okay, push a like for the YouTube algorithm so that this would go to more people. We're trying to help educate a lot of people here. So in a case like this, there's a multitude of reasons as to why a person like this may have lost multiple upper teeth. Okay, they could have lost them all at once. They could have had, for example, one missing tooth, like one congenitally missing tooth since birth, like a lateral is often congenitally missing teeth is somewhat of a more rare case for or rare reason for teeth to be missing, but it is present. One of the common congenitally missing teeth is the lateral. Okay, the tooth next to the central, okay, so which would be somewhat in the middle here. So that's one, but there are of course many reasons. It could be due to caries, like cavities, due to trauma, due to multiple really many reasons. A person can lose a teeth. It could be due to failed root canal treatments. It could be due to root canal treatments that were done, but the crown became too weak and the person did not crown the teeth or did not have some sort of full coverage restoration, and subsequently later on these teeth may have fractured or got broken. Okay, so later on in this video also we will have a Q&A section. In this live stream we will have Q&A sections. I'll post also important part of this as a separate video as well. Okay, right, just 1 second because I read some of the comments. Okay, welcome everyone in the comments. I need to continue because this is for everyone. Right, so as I said, summary for the just some of the reasons as to why a person like this may have lost their teeth. I just set up, by the way, a live stream goal for those in the live stream. It really helps support the channel if you enjoy these live streams. You can find it in the corner. So why a person like this may have lost their teeth? As I said, it could be due to trauma to the teeth, either got a punch, a car accident, they fell on the ground, the teeth were root canal treated previously, either with failed root canals for the missing teeth, or due to, for example, huge cavities that were left untreated, then it became too late, the teeth became unrestorable, so the person lost the teeth. Okay, so I'm just gonna show you here what I'm talking about. I'll draw a little bit if you don't mind with a yellow. Okay, so I'm talking about this region here. Okay, I'm talking about this region here where the person may have lost their teeth. Just to be clear with everyone, because they may be seeing the rest of the teeth seem to be somewhat okay. By the way, everybody say hello in the chat. Welcome everyone, and people who watch this later, comment too if you're interested in something like this. Okay, so what are the potential solutions for this? This is often what people are most interested in, so I'll talk about this. Number one, you can think about something that is relatively cost effective, so like a budget option for missing teeth like this, and that would be a denture, something called as a removable partial denture. Now, what does removable even mean? Removable partial denture, it means a denture that a person like this can wear and remove, and this is actually a permanent solution. So this is a permanent solution. They will live with this denture. They will need to remove it. They can wear it every day. They have the freedom in relation to that. Some people get it as a temporary solution, or until they have the budget or until they have the funds to get dental implants in the future, which leads us to the alternative option if the bone allows and if the case allows, and that would be, for example, dental implants. Okay, so in a case like this, someone can potentially replace those missing teeth using dental implants. Now, what is the problem with the dental implants? Of course, dental implants inherently have uh, issues, and they may fail, or, although the success likelihood is relatively high. Welcome F1, welcome Soy Landon, welcome everybody. Please everyone double tap on the screen. Don't forget to like, double tap on the screen, like, share this with your friends. Okay, so we have removable partial dentures, RPDs. We have dental implants as a solution. So what is the core difference between them? The core difference is removable partial dentures is something that the person would wear and remove. They're not fixed in position, whereas the dental implants to replace the missing teeth there would be more of a fixed solution, meaning they would stay in place until a dentist or an oral surgeon or someone with a trained hand can, under clinical conditions, remove those dental implants if it's indicated or if it's necessary, or whatever the necessary reason or the reason may be to remove the dental implants. Whereas the removable dentures can be removed by the person who's wearing them to clean them later on to help the gums relax, etc. Now, of course, both need an excellent level of oral hygiene and maintaining a really clean teeth and gums. Welcome everyone who's joining. Do me a small favor, just double tap on the screen. Please like on the stream. Yesterday we crossed the 25 likes. I think today we can get even more likes. We have people joining in the chat. F1 says, hello, I don't know what BD means. Welcome. Oh, BDS is Bachelor of Dental Surgery. We have Thoy Landon. Welcome, welcome everyone. Say hello in the chat and in the comments if you're watching this later. Welcome everyone. We also have a live stream goal here. Right, so this is with removable denture. They need to maintain the hygiene of the removable denture itself. They need to maintain excellent oral hygiene in relation to the gums and the rest of the teeth, okay? Of course, follow-up visits are important with the dentist to make sure everything is okay over long time horizon. With regard to dental implants, they also need a person to, if they want really good result and to maintain it for a long period of time, they will need really excellent oral hygiene and maintaining really good health of the gums and everything. Because if someone gets implant and gums get infected and the bone underneath them start getting infected, that may lead to gradual bone loss, and then dental implants becoming loose, which may in turn, unfortunately, lead to the loss of, which may in turn lead to, the loss of a bone. Subsequently, later on, the dental implants become loose and the person may have failed dental implants. Welcome, Harun, my friend. Everybody do me a small favor, like on the stream or on the video if you're watching this later. Please share this with your friends. Double tap on the screen. It is free. It will really help support the channel. Okay. Right, so we have removable partial dentures. Okay, so why do we call them removable partial dentures? Removable, I told you, because person can actually take them off. They can remove them from the mouth. Partial, because they're not a complete denture or complete set of dentures. And denture, of course, the word, because there are prostheses, there are dentures that are created in a lab, okay? If you want, I can go over the steps of them. Someone is asking about mewing. Do you want me to answer about the mewing? This is an interesting question. We have Harun here asking about mewing, if mewing is legit. Let's get some more likes on the stream. And maybe I'll talk about mewing. Mewing is a very popular topic in YouTube Shorts and across the younger generation. I personally am not a huge fan of mewing. Maybe I'll talk about this a little bit later. Have an overbite. Okay, so overbites, underbites, problems in relation to teeth alignment, malocclusions, all of these best to be addressed by an orthodontist. So please visit an orthodontist. They will help you with these things. Of course, not medical advice. Everyone, this video is just for educational purposes. So everyone say hello in the chat. If you have a suggested topic, you can either say it or join us. We also have a live stream goal. Also, double tap on the screen. What are you waiting for? The weather is good today. It's raining a little bit. I hope everyone is having a great day. Welcome, Bisham. Welcome, my friend. Welcome, everybody. Please do me a small favor. What are you waiting for? Double tap on the screen. Like. Yeah, a lot of people are liking. Let's go. Like. Really appreciate it a lot. So liking is a free way to support the stream. Everyone say hello in the comments as well. Welcome, everyone. Okay, so we talked about permanent solutions such as removable. Welcome, Vincent. Thank you for the kind words. Vincent, where are you watching from? Please let me know. Please let me know. Thank you for the very kind words. Nancy also says some amazing things. Really appreciate a lot. Says happy Friday to you and everyone that's participating. Thank you everyone really for the kind words. I appreciate it a lot. It really helps support the channel. Also, people who double tap, who like, it's something very small but can help a lot with the stream. I'm not really doing some of these random live streams. I try to educate people more on oral health. Really, that's my goal. Okay, everyone. So we talked about permanent solutions. Okay, permanent solutions in terms of something like a dental implant or removable partial dentures, which in short they are called RPDs, which are in short called RPDs, okay, removable partial dentures. I need to put someone as a mod. Some people are annoying. Right. What about temporary solutions? There are many temporary solutions. There are some forms of removable dentures that can also be used. That can also be used as a temporary simply solution. There's also, I think, a clear denture, which is like a clear thing that someone can wear with acrylic teeth. If I'm not mistaken, I did some of these long time ago when I was still in training, of course, under supervision of consultants at the time. I participated in a lot of dental implant surgeries for single tooth, for multiple teeth, for full sets of teeth. Which I was lucky, of course, to do during my training, meaning I participated in them. I was not the person in charge doing these. Vincent says, watching from Belgium. Welcome, my friend. Welcome, everybody. We have people watching from Europe. Nancy is watching from the US. Someone says they got their... Bro, this fly, I swear, there's an annoying fly, sorry. I have a tennis racket that can literally hit some of these flies. Welcome from Belgium, my friend. Which part of Belgium? Isn't there like a French part and a Dutch part? Recently got off the braces. What do you mean it got really weird? I didn't understand. Congratulations also if you finished with your braces. It's a long journey. Watching from Belgium. Everybody let me know in the comments, where are you watching from? Welcome, everyone. Watching from Texas. Welcome. Shout out to all people in Texas. Isn't Elon Musk also in Texas? Nancy says, watching from Dallas, Texas. Welcome, Nancy. Welcome, everyone. Are there more people watching from the US? Let me know.